enough, that you have to be your best advocate. You have to stand up for yourself. During this journey, I found my voice, and I had to, because I didn't share my diagnosis until after my surgery, and that was 3 months after my diagnosis that I had my lumpectomy, and I didn't share. So it was me and Jesus, and then my healthcare team. So I had to learn, and I listened, and I watched. And one doctor, Dr. Thomas, African-American doctor, I watched how she navigated asking the questions of my treating hospital. And I listened to her, and I watched, and I said, okay, then I need to be just that aggressive, because remember, your ultimate goal is to live. And so you need a healthcare team that's on your team. And I asked them every time, are you Team Lynne? Because if you're Team Lynne, these are the objectives for Team Lynne. Team Lynne wants to live. And I brought myself as far as I can go, as far as my knowledge and my understanding of cancer, and I need you to take me to the goalpost. But if you're not Team Lynne, then you can't, if they're not Team Lynne, they cannot continue to help you with that process. And you listen to their conversation. Are they attentive? Are they giving you the information? Don't hold back. You need to know. You cannot be afraid of knowing all things about your treatment and your treatment regimen and the outcomes of all of that, because that's how you can make an informed decision.
Most people will experience at least one diagnostic error in their lifetime. What steps should you take to help prevent yourself from being misdiagnosed?
So I'm all for second opinions. And so Fox Chase was my second opinion hospital. And you get your first diagnosis, and if you're not uncomfortable, if you're uncomfortable with the information that you've obtained, then go and get a second opinion. But the ultimate key is, don't leave that treatment room or that examination room with any unanswered questions. And if you don't know the questions to ask, you turn it back to the doctor and you say, listen, are there things or situations answers to questions that I need that I don't even know to ask? You don't leave the room saying, I think they meant this. No. And if they're talking too fast, you say, slow it down as if I am a 2-year-old, and explain it to me again and again and again until I get it. Because remember, that's their profession. This is your first time experiencing this. And so sometimes our doctors and our medical healthcare team can get in a regiment and they're just sharing because that's what they do, not knowing that this is a brand new person, a brand new to you. And so slow it down, and the key is, don't leave that room with unanswered questions.
How did being diagnosed change you?
OMG. It was like the Twilight Zone. I couldn't believe that cancer was attached to my name. Lynne Alston, you have cancer. Those words bounced off that wall at least 100 times, and it just kept coming. Lynne, you have cancer. Lynne, you have cancer. But I knew I needed to live. I needed to be here for my mom. I wasn't ready to throw in the towel. And so I did my research. I went online, I looked up clinical trials, didn't know how clinical trials worked, but the next time I had that appointment at Fox Chase, I said, listen, I went online, I saw this clinical trial, I want to be a part of this clinical trial. And so as African American, women of color, we are not in those numbers. We are not in the clinical numbers, clinical trial numbers. We don't participate. We have some history on why we don't participate, but we need to be in the numbers. So they were taken aback that Black woman asking for a clinical trial. I didn't get into that one, but I did get into one. And with the clinical trial, I had more eyes on me, so I would not fall in between the cracks like some of us do. And so when it was time for my treatment infusion room, I would have somebody meet me at the door. When it was time for radiation, someone was meeting me at the door. And so clinical trials can have additional eyes on you where you're not falling in between the cracks, and you're getting the most up-to-date treatment regimen attached to you.
What